Welcome to the Empowered Aging Podcast. Your host is Michelle, a physical therapist passionate about helping older adults stay active, mobile, and independent. Let's dive into today's topic.
Welcome back to the podcast. I had to take a couple weeks of hiatus because I pretty much lost my voice, but it's back enough anyway to continue on, because I wanted to get back to this topic of how to move, how to exercise, and how to just move in general after a total hip replacement. So in the last video, we talked about how to proceed, how to move in those first few weeks or first few couple of months, as long as those hip precautions are in place. Now, again, keep in mind that not everybody has hip precautions. So making sure that you understand what your surgeon wants you to avoid, not avoid, is super important. So today, though, I wanted to talk about that next step. Those hip precautions are generally only in place for maybe 6 to 8 weeks in general. Always exceptions, so always check with your physician, but in general, that's how long they want you to be extra cautious to allow for healing after the surgery. But once that first initial actual healing in your body is good, it's time to move. Because once you're allowed to move, if you don't move, then your movement, your walking, your getting up and down is really going to be impaired. So it's important to get back into normal movement as soon as you're allowed. So not only have you been moving differently since surgery, but you've likely been protecting that joint, that hip, for weeks, months, even years, depending on how long you put off that surgery, how long you've been putting up with the pain. So you've got a lot of catching up to do, basically. Your body has learned this new way of moving that's been very protective, very guarded. And because of that, your muscles have tightened up, they've gotten weak in some respect. And so not only are you recovering from surgery, but you're recovering from all of that movement impairment that has accumulated over that time. So it's going to take time to recover, possibly years to regain normal movement. So I'm not asking you to rush through and get right back out to, running and doing all those things, but keep in mind that you had this hip replacement not only to get rid of pain, but to allow you to move again. It wasn't done to restrict you. It was done so that you could get back to normal movement. So today I want to show you some progression of the exercises that we started with on the last video. Those were done assuming some hip precautions were in place. Now we want to move to the next step, that next level of getting back some of that movement. So, with that being said, let's get started. In the last video, I showed you how to start getting some hip rotation by working on this sliding of your heel up and down. I want you to continue that exercise until you can get it up onto the other knee. Once you can get to this position, and by the way, remember, you can make it a little bit easier by straightening out that other leg so that this one doesn't have to raise quite as high. And I'm going to show you how to do it with my foot in a good position here. So you might start off kind of like this, right? That hip's really tight, it just won't go down. So we start with just some gentle movement, trying to open up this hip, get some more rotation because that's going to make this movement easier. Getting to your feet for pedicures or just lathering up, lotion, putting on socks and shoes, all these everyday tasks that we take for granted. So just by gently pressing, I'm not encouraging drastic pushes, just an easy on and off. Again, I don't expect your knee to go as far as mine right away, but a little bit every day can make a world of difference. Once you can get it to a point where it's, down a little bit, not quite jammed up this high, but close to being flat, I'd like you to think about adding in a stretch for the back of your hip. You may have seen this in other classes where we're going to come forward, but it's so important to come forward at your hips, not your spine. So I'm going to ask that you straighten up nice and tall, activate that core, and keep your back straight, hinging at your hips. See how I keep my chest up? I'm not rounding over this leg. When I do that, all I'm doing is stretching out my back. My target right now is those butt muscles, those deep hip muscles in the back. So by keeping myself straight and upright, hinging forward at my hips, my back is not rounding, and I can support myself on my legs here. And now I'm really feeling the stretch deep in my butt muscles of the bent leg. Now, as I've said with other stretches, you might want to just do a nice easy on and off. If you prefer to hold it, you can do that too. So whatever you prefer, whatever feels better for your body, maybe a combination of both. But most important is that you're targeting this muscle by keeping your back straight. So if I were to show you from the side, what I'm not wanting to do is this, where I'm just rounding my back. Instead, I straighten, keep all this engaged, and I hinge at the hips as if there's a rod going down my back. Then I'm going to feel the stretch at the hip. So alignment matters. Technique matters. Exercises lying down are a great way to work your hip without worrying about your back getting tweaked or keeping it in a good position. Now, I know a lot of you are seeing me on the floor and thinking there's no way I can get on the floor. We'll get to that. But if this is something you don't feel comfortable with, then I would suggest my next option would be on a couch if you have something long enough, because the second exercise, I'd like you to have support at your back. If that's not possible, then please just do it on your bed, as firm as possible, hopefully. But stay tuned, because next week's podcast, we're going to talk about this floor mobility, the importance of getting on and off the floor and ways to do it. But we'll talk about that next time. So, however you can lie down, wherever that may be for you, the first one I would suggest doing for your hip, once you're past those hip precautions, is bringing your knee to your chest. It's important that we regain this motion so that you're able to get to your feet, put on socks and shoes, and just move normally, right? It's going to help you get in and out of chairs, all that kind of jazz. So, if this is the hip that was operated on, I can use my hands. You could use a strap or a long sheet if you like. And I'm going to really work on also pressing this other leg down so that it's not following me. If it follows, then what you're doing is you're rounding your back and your pelvis. So this other leg needs to stay down while I pull this knee up toward my chest. Now you may very well be starting way down here. It is what it is. You start where you are and start working your way up. I personally prefer a method of just an on and off, not worrying about holding it for long periods of time, just easing it up and down. While I'm doing this, again, I'm pressing my other leg down to help hold my pelvis and my back in a good alignment. Now, with that being said, it's not a bad idea to also pull the other hip up, the unoperated leg, towards your chest so that you can work on pressing the operated leg down, getting a little stretch here at the front of your hip while the rest of your body is supported. So by pressing the operated leg down, I'm stretching the front. By pulling the operated knee up toward me, I'm stretching the back of my hip. While you're here, you could also work on just some nice movement using your hand, your arms to move the hip. I realize you will not be able to move as much as I am now, but why not start to try? Every little bit is going to help you regain some movement. These next two exercises I like to do with my back against a couch. You could also do it against a wall, or if you're up on the couch, against the back. Both hips need to be up against so they're supporting me. So I am fully on my side, making sure your bottom hip is also touching. This gets me in a really good alignment. I start with my knees bent, my knees together, and I'm going to do the clamshell. So we did this on our backs where we opened up both knees out as far as we could. Now we're just going to move this operated leg, moving against gravity to help strengthen these deep hip rotators. I like to leave my hand in front because that makes sure my body's not rolling backward. Or you can also place your hand at your hip to make sure that it's not rolling back as you raise your knee up and down. Either way, I want you thinking about activating your core here to help keep the rest of your body still. So I'm only moving my leg. I feel the muscles here in my glutes working. As this becomes easy, you can even add resistance by placing a band around your thighs, close to your knees. The next one I like to do is hip abduction, a side leg lift. This one's also easy to cheat with, which is why I like you to be up against the back of something here. So my hips are lined up against the back of the bottom here of the couch, so I'm not rolling backward, which is a big cheat. My toes are pointing straight ahead, and I'm going to slide my foot up along the couch. So I'm not bringing it forward or back. I'm just sliding it up and down. That helps to keep things lined up. You can also put your hand here at your hip to make sure that you're not doing this extra movement. I only want the leg to move. And if you can just move a few inches off the floor and back down, that's absolutely fine. I'd rather you do that than do a lot of cheating trying to get it further. Keeping yourself in line here with the couch helps to keep your body in good alignment and keep you from cheating. You should be feeling this here, kind of at the side or back of the leg, but you might also feel it down into the thigh. So those are the two exercises I'd like you to do on your side. In order to start seeing improvement in routine movements like being able to go up and down stairs, it's important that we train our muscles for exactly that movement. So I like to start with a step. Now, it's a little bit high to start with, so you might want to find something lower. I like using thick cookbooks or encyclopedia kind of things, something maybe a little bit thicker that you could start with and start working your way up to something until you can get to the height of a true step. Going up steps is generally easier than going down. So I would start with the up movement, this being my operated leg. I would practice the up and down of the other leg so that this leg learns how to lift me and lower me back down in this position. As I come up though, I'm keeping this posture really tall. I'm pressing through my foot, making sure that my butt muscles, giving them a little extra oomph, a little extra attention so that they fire to help me, so that it's not all here in my quads. As that gets a little bit easier, I want you to then add in the other part, the down, the forward down. So again, this is my operated leg. It needs to learn how to hold me and not let me just drop. As I place the other leg down, I'm allowing this back heel to come up because that's what we do. We don't do this, right? That's not how we go downstairs. We go forward. This heel comes up. My weight goes forward over this leg that I just put down. So again, practicing this movement on something small to start and work your way up. We need to train for real movement. So in the last video, we talked about stepping our leg forward and back, both with the operated leg and the unoperated leg, so that your operated leg could work on both skills, the movement and the holding you up part, stance and swing phases of gait, as we say in therapy. So now I want you to progress yourself to actually walking along a counter, somewhere where you don't have to hold on much, but you're working on taking a normal stride, the same length on both sides. Your foot should be able to easily pass the other. And notice I'm going forward and backward, keeping my posture up tall, so I'm not bending over, I'm not leaning backward, right? I'm keeping that nice tall posture, really working on shifting my weight over the one leg before I move the other. Super important so that you don't step too soon. If I don't put all my weight on this leg before I move this one, it's got to be fast. But if I take the time to stand tall, I can freely move the other. If that's still difficult for you, work on just the movement, just like we did in the last video. This part is crucial. before you can move on to normal stepping. You can also work on isolated hip movements here where you're standing. We can be working on up and down. We can work on the side. We had this one in the last video. And also extending the hip. When you work on extending your hip going backward, instead of this swing motion, which I believe is so easy to cheat with. When we're doing this, we're very likely arching our backs, maybe leaning forward. These butt muscles, these glutes, don't really get isolated well. So in order to isolate those, I prefer that people set that foot back behind them, putting all your weight on this front leg, standing tall here on this leg. And all I do here with my back one is I push my knee straight and then release. But I'm really focusing on my butt muscles to do that. So I put in a nice little squeeze to press my thigh back. Push and release. Push and release. Now, once you can do these motions pretty well, good quality, I want you to start adding some resistance. And this is a really nice band that I have found. It's fabric, so it's more comfortable, and it doesn't roll up on the skin like some of those more, rubberized ones do. And this one has a buckle, so you don't have to worry about stepping in and out of it. So instead, I can easily buckle it around. I like to place it just above my knees. And now I can do those same exercises with some resistance. So if I want to lift my leg up and down, I can do that. And notice the band really doesn't slip much. So it's giving me just that little bit. And these come in a nice set of light all the way to heavy. I think there were about 5 bands. Raising the knee up and down, again, good quality. And once you add resistance, you might need to reduce the number of repetitions that you do, and that's fine. If I were to do the side step, again with the band, I would want to make sure that my posture is up tall, my feet are still facing forward, so that I'm not adding a cheat. And you could do several steps in one direction, maybe along the counter, and then back the other way. You'll notice that going one way is going to be a little easier than the other. And I can use this same resistance band for that extension. So again, my weight is on this front leg. This is my operated leg, or the one I'm wanting to work on. My foot is back behind me. I start with my knee bent, and then I press back. My weight stays on this front leg, and I actually prefer to have it just a little bit bent, but I'm still forward. It just helps lower me and makes this back movement a little easier. Focusing in on these glutes. As we age, and particularly if you've had any type of hip surgery, these glutes start to shut off. Because when we start to sit a lot, these hip flexors get tight and we don't engage the glutes very much. And so they kind of forget how to work. They call that gluteal amnesia or dead butt syndrome. And I do not want one of you, to have that. So it's important that we isolate and use these glutes in order to be able to move more naturally. Yep. So if you're interested in having a resistance band like this, I will put a link to it in the show notes below. You can find it on Amazon, but I will provide that link for you to make it easier. I hope that you found those exercises helpful to you in your recovery, whether you've had a hip replacement or you're just feeling weak and not very flexible. Those are great exercises to get you going. Now, I understand that not all of you are going to be able to do them, or at least not easily, but I ask that you do what you can. Just make sure, if you're concerned about precautions, that you check with your surgeon. But very likely, you will have no precautions remaining after the first few months of surgery. If you have any questions about how these exercises would fit for you, or maybe other exercises that you could do to accomplish the same tasks, because there's always more than one way, please feel free to reach out to me. I want to help everyone restore normal movement as much as possible. I don't want your hip replacement to be holding you back. I want it to be the first step to getting back to your normal life. I want all of you to remain independent and active for every day of your life.
Thanks for joining us today. If this episode helped you learn something new, we hope you'll share it with someone who could benefit as well. Until next time, keep moving, stay strong, and take care of your body.